Yeah, Lisa, great question. That is not unheard of in healthcare because you often have a small percentage of really sick, chronically sick patients who have a huge amount of cost associated with them. However, having said that, we can do better. And fundamentally, we can do better in our new public-private partnership charity system and in Medicaid by focusing more on primary and preventative care. Traditionally in Louisiana, we've always had, since at least the 30s, a charity system. We've always had a generous system to provide health care for the truly needy, but it's traditionally been hospital-based, sort of show up at the emergency room. Well, that's a problem. It's a problem for the patients because it's the worst care possible to allow their problems to develop and grow until they walk into an emergency room. It's a problem for the taxpayer because it's that setting where care is the most expensive. We need to push out and evolve from that model and focus a whole lot more on primary and preventative care. We're doing that with the new public-private partnerships. We're doing that to some extent with Medicaid managed care, although Louisiana's version of Medicaid managed care, Bayou Health, I think is much more Medicaid managed payment than really managed care, and I think we can have a lot more improvements there. So fundamentally, I would look to do that. That also brings up the significant issue of Medicaid expansion. I've said from the very beginning I would not rule out considering that Medicaid expansion that's available from the federal level, but I would only consider it if some hard questions are answered and if we have a clear plan moving forward in at least three areas. Number one, additional state dollars would be required. It's not all free money. And so where are those additional state dollars going to come from? Do we have a clear, cautious plan of raising those state dollars from providers, not taking from existing needs like higher ed for those additional state dollars? Number two, are we going to reform Medicaid, not just expand what in some ways is a broken system? Reform it as I'm describing, focusing on primary and preventative care, focusing on coverage, not just showing up at the emergency room. And number three, are we going to require able-bodied folks to work? We don't do that to nearly enough and an extent now, and we need to require able-bodied folks to work. We certainly don't need to increase the disincentive for able-bodied folks to work.